Mike Gibson, Sekar Kathiresan, and we're talking about an exciting new advance in gene therapy for people with high cholesterol. Sek, you're the CEO of Verve Therapeutics. Talk to us about the exciting news today.
Well, Mike, thanks for having me back on. Verve is trying to create a one-dose future for patients living with high cholesterol or heart attack. And what I mean by that is a single intravenous infusion leading to lifelong cholesterol reduction and enduring efficacy. That's really our vision. And the data we presented today is with our product called Verve 102. And this is a in vivo gene editing, base editing medicine that is delivered as a single intravenous infusion. We share data for 14 participants. These are patients with HeFH or premature coronary event. So men or women less than 55 or 65 who've suffered a coronary event. And we had 14 patients treated across 3 dose levels. And what we were able to show is safety, LDL reduction, and PCSK9 reduction. And let me walk you through what we saw. First of all, most important, the acute infusion of this drug over 2 to 4 hours was very well tolerated, Mike. There were no treatment-related serious adverse events. There were no cardiovascular events. There was no dose-limiting toxicities. And importantly, we had no laboratory abnormalities, no changes in ALT, no changes in platelets. All of these are things sometimes you can see with LNP infusion. So very,
Yes, I mean, we had bad news today from Pfizer on liver toxicity, and the drug is acting in the liver, so it's clean with respect to the LFTs. Is that right?
okay, yeah, so very well tolerated. Second, on efficacy, what we saw at the dose level that is roughly 50 to 60 milligrams of RNA delivered, so that's the highest dose group of the 3, the average LDL reduction was 59%. We had a maximum of 69%, and then everybody in that group got over 50% reduction. So really excellent, competitive with the most, the potent agents on the market right now, the inclisiran or the antibodies. So that was great. And then importantly, durability, because our differentiation is the idea that you're going to be able to lower the cholesterol 50 to 60% and keep it there for a long time, ideally for a lifetime. So we made progress there as well. We shared today durability data for an earlier version of our product called Verve 101. And in that study, this has started a few years ago, we have durability out almost to 2 years after base editing. So we were able to get the LDL down about 60%. And then after the single infusion, 2 years later, the patient's LDL was down 58%. So I think all aspects of what we're trying to do, safety, efficacy, and durability, really came together today to give us confidence that our vision for a one-dose future for high cholesterol and/or heart attack should be possible.
One and done. Well, you know what, Sik? This afternoon, I took my Repatha injection. I have a couple of questions for you. Is the magnitude of lowering you get with the infusion and turning the gene off, is that a little bit greater than when I give myself those injections?
Ours is a phase 1 trial, so I hesitate to kind of compare directly with the phase 3 data. But in general, antibodies a lower LDL by somewhere around 50%, maybe
So
50.
50% with what I'm taking, you're getting 59%. Yours is a constant low. Mine is kind of bouncing up and down.
And yours is bouncing up and down, Mike, but more importantly, you're somebody who takes it every 2 weeks.
No, that's the problem, is
Okay.
I forget.
Okay.
That's what I forget. So that's the one and done thing is really important in
Well,
terms
so you sometimes forget, but what happens for many patients is, I think, exposes this unmet need that you're kind of hinting at, which is for the majority of patients who take a PCSK9 medicine, the discontinuation rates, Mike, are really high. There was data presented at the ACC, this past ACC, by Bob Rosenson, and he basically, they looked at discontinuation rates for inclisiran, the siRNA targeting PCSK9,
sure.
like VO, given, ideally twice a year. They also looked at discontinuation rates for Repatha. And believe it or not, at 1 year for Leqvio, the discontinuation rate was 1 in 5 patients have stopped. For Repatha, it was 1 in 2.
Wow.
And so the effect, the clinical impact of that is dramatic. So
Yeah.
the real world LDL reduction for these patients was like 25 to 35%, not the label 40 to 60%.
Right. Right.
This is the
Yeah.
problem we're trying to solve.
And those are inhibiting PCSK9. There was a lot of worry out there about, oh my gosh, what if you drop that level too low? I mean, is it safe to not have any PCSK9? I mean, do we know the safety of dropping things down low?
We do. And that's based on people who naturally lack PCSK9. As you know, 1 in 50 Blacks have a mutation that knocks their PCSK9 down in every cell in their body by 50%. And those patients are remarkably protected from heart attack, like 90% protection. And then they don't have any adverse effects. And there's a lot of people like that.
You're changing one letter
Yeah.
in the gene, right? And so is
Turn it
that
off.
giving you complete reduction or a halving of the amount that's made?
So we're getting roughly probably 70% reduction, something like that.
70% reduction. So
So,
the
and then on top of that, the safety, Mike, comes from the fact that the antibodies, like what you're taking, Repatha, there's been some very nice work by Bob Giuliano and others at the TIMI group. They've looked at from all of the PCSK9 antibody trials, the patients that have gone to LDL, let's say below 35, and there's a lot of them. And they've looked at the safety, the neurologic safety, the overall body safety, and very well
right.
tolerated.
And the other problem, maybe with not some of the current drugs, but with another drug that was in this market, another PCSK9 inhibitors, you can develop anti-drug antibodies. So that's something to watch out for with that class. Now, the other problem I have, Sec, is I have a very high Lp(a). So what are you going to do for me? Are you going to be able to knock that gene out
We
too?
have we have a one dose future envisioned for LPA as well. So that's the third program in our pipeline. Our pipeline basically focuses on the three main carriers of cholesterol in the blood. One is LDL, and that's the target PCSK9 in the program we're talking about, VERV 102. We have a second program that targets triglyceride-rich lipoproteins because they carry remnant cholesterol. And that target is called ANGPTL3. That's our second program called VERV 201. Again, a one-time infusion turns off the ANGPTL3 gene, lowers triglycerides and LDL. Then the third product is LPA, targeting LPA, because the third carrier of cholesterol in the blood is lipoprotein little a. And so we have a product that is in preclinical development right now. And again, a one-time infusion, lifelong lowering of LPA. And that's a collaboration with Eli Lilly.
Great. Well, Sec, lower is better, but are we going to figure out that earlier is better with this kind of treatment? I mean, someday, if this works, who's it going to be for, and how early might someone want to start this if they have elevated LDLs?
Well, I'll give you an example of one of the patients treated in our trial. In one of our trials, it's basically a gentleman who had a heart attack prior to the age of 30
Mm,
and had an LAD stent, came
mm,
into our trial. I think he was like 29 when he came into the trial. He got the one-time infusion. LDL came down, 60%. 2 years later, it's still down 60%. The entire 2 years, he's had an LDL below 1 millimole,
wow.
below 40 milligram deciliter. And
Hmm.
think about that for his whole life, he's going to have that. And the plaque, as you know, ultra low LDL not only stabilizes, but it actually can regress the plaque. And so, he's the kind of person I think, for the premature coronary disease, the patient with HeFH who's had a strong family history, these are the kind of patients we think will be early adopters for this new approach.
Well, the reason I ask, you know it, but I want to make sure our audience knows it. It's the concept of cholesterol years or LDL years. It's multiplying that bad cholesterol or cholesterol itself by the number of years. The higher that number, the worse the outcome. And now you can reverse the curse at a certain point in your life by keeping it down and keeping it low. Well, Sek, I'm so excited. This is just absolutely fascinating. Thrilled to get you on today. Thanks for sharing with us. Any final comments?
No, thank you, Mike. We're really super excited to be able to work on this. This really a one dose future for chronic disease. I think it's an exciting possibility, and the data today, as I said, really suggests that this should be possible.
Great. Congratulations, Sek. Look forward to more from you.
Thank you, Mike.